Here is an interesting case scenario. Here we can see a swelling in the lower and anterior part of the neck. It's most probably a thyroid swelling, and the clinical condition is called as goitre. Irrespective of the functional status of the thyroid, whether it is normal thyroid function test, which is called euthyroid, or increase in T3 T4 level, which is called hyperthyroidism, or decrease in T3 T4 level, which is called hypothyroidism, irrespective of the functional status, the thyroid gland is enlarged. We call it as goitre. Why does the swelling move with deglutition? This is the second question. So the swelling, thyroid gland swelling, moves upon deglutition because of the fact that the thyroid is enclosed by one fascia called pretracheal fascia. As we all know, the thyroid gland is like a butterfly. Just imagine the butterfly being encircled by one gift wrapper. The gift wrapper here is pretracheal fascia. This gift wrapper or the pretracheal fascia is attached superiorly to the hyoid bone and oblique line of thyroid cartilage. Also, the posterior lamina, once it splits to enclose the thyroid gland, the posterior layer lamina of the pretracheal fascia gets thickened to form ligament of Berry, which attaches the lateral lobe of thyroid gland to the cricoid cartilage. So I'll tell you three reasons for this movement upon deglutition. When you swallow, look yourself in the mirror, the entire larynx moves upwards. This thyroid gland is enclosed by pretracheal fascia and that is attached to laryngeal skeleton. Point number 1, it is attached to hyoid bone superiorly. Point number 2, it is attached to oblique line of thyroid cartilage superolaterally. Point number 3, on a deeper plane, there is a thickening called ligament of Berry which is attached to the cricoid cartilage. Since larynx moves upon deglutition to close the laryngeal inlet by approximating to the epiglottis, the pretracheal fascia which is attached to the larynx also moves. Within the pretracheal fascia, the thyroid gland is there, that will also move. So whatever I told is only for Viva. Here for the notes purpose you can write, because the thyroid gland is enclosed by pretracheal fascia and you can tell ligament of Berry holds the thyroid gland to the cricoid cartilage. That's good enough. The description what I gave now is for a Viva. Okay. So what is the reason for dyspnea and hoarseness of voice? Dysphagia also you can add. I will tell you three reasons why there are dyspnea, dysphagia and hoarseness of voice. Dyspnea means difficulty in breathing. The medial and the deeper relation of the thyroid gland is the windpipe, the larynx becoming the trachea. Thyroid gland enlarges more on a deeper plane than on a superficial plane. Therefore, the thyroid gland enlargement presses on the windpipe, that is usually the trachea, resulting in dyspnea, that is difficulty in breathing. Why these patients will also have dysphagia? This is because deep to the trachea there is foot pipe. The foot pipe name is esophagus, that is the pharynx continues. Therefore, the enlarged thyroid gland or goiter presses on the foot pipe or the esophagus, resulting in dysphagia or difficulty in swallowing. It can also have hoarseness of voice because the tracheoesophageal groove is related to recurrent laryngeal nerve, which is the main nerve supplying all the muscles of larynx except cricothyroid, which is supplied by external laryngeal nerve. This relation makes it obvious that when the trachea and esophagus are compressed, even the recurrent laryngeal nerve can possibly be compressed, resulting in change of voice or hoarseness of voice. So I'll tell you, dyspnea is due to compression of windpipe, that is difficulty in breathing, dyspnea. Dysphagia is due to compression of foot pipe, that is esophagus. Hoarseness of voice or change of voice is due to compression of recurrent laryngeal nerve. All the compression of this windpipe, foot pipe and the nerve is due to enlargement of thyroid gland, which is called as goiter. So the clinical condition is goiter and the swelling moves on deglutition because of the pretracheal fascia attachment and the ligament of Berry. Dyspnea is due to compression of windpipe. Dysphagia is due to compression of foot pipe, that is trachea and esophagus respectively, and hoarseness of voice is due to compression of recurrent laryngeal nerve, which is there in the tracheoesophageal groove. Thank you for watching and learning from Logic Medico. Kindly consider subscribing. Don't forget to press the bell icon to get the latest notification. Share this video with your friends and also give a thumbs up icon if you like the video. Thank you once again.